An A1C test is also known as glycated hemoglobin, glycohemoglobin, or HbA1c. It measures the amount of glucose in your blood. More specifically, it checks hemoglobin, an iron-rich protein that transports oxygen and nutrients throughout the body. Glucose, a sugar the body uses for energy, binds to hemoglobin, creating glycated hemoglobin compounds. The higher your blood glucose level, the more glucose attaches to the hemoglobin. Hemoglobin cells last about 90 days, so the A1C provides an overall picture of your blood sugar control for the previous 3 months. For people without diabetes, A1C tests are recommended every 3 years in adults over the age of 45 and anyone with a high risk of diabetes. Risk factors include a family history of diabetes, a BMI above 25, high blood pressure, a history of heart disease, and a lack of physical activity. For people with diabetes, regular A1C monitoring can catch a spike in blood sugar levels early. An increase should prompt your healthcare provider to reevaluate your treatment plan. This may include a review of your medications, diet, and how often you test your blood sugar. What is a high A1C? A1C results show the percent of glucose and hemoglobin bound together in your bloodstream. For example, a 5% A1C indicates 5 out of every 100 hemoglobins are glycated. The higher your A1C, the greater the risk of developing complications. The A1C ranges for normal, prediabetes, and diabetes are: normal, less than 5.7%. Prediabetes, 5.7% to 6.4%. Diabetes, 6.5% or higher. Talk to your healthcare provider if your A1C is in the prediabetic range. Prediabetes is a risk factor for type 2 diabetes. A diet change, increased activity, and moderate weight loss can help improve blood sugar control to prevent diabetes. A1C levels in people with diabetes. For people with diabetes, an A1C under 7% is typically considered good control. Research shows an A1C above 9% significantly increases the risk of diabetic complications. For adults with diabetes, the target A1C range is typically between 7% and 8%. This depends on your age and other health factors.